My name is Francine Scaboria and I work at Safe Berks. Safe Berks is the local nonprofit which serves survivors of domestic violence and sexual assault. Our services are free, they're available 24 hours a day, 365 days a year, and they're available in English, Spanish, or any other language needed. Now I want to welcome our guest today, Macy Lengle. Yes. Welcome. Thank you for being here.
Of course.
And Macy is one of the new Medical Advocacy Partnership Program Advocates at Safe Berks, which we kind of affectionately refer to as MAPP.
Yes.
Because it's easier, right?
Yeah, absolutely.
Great. So congrats on that.
Thank you.
And maybe tell me a little bit about the MAPP program and your location within the MAPP program.
Okay. So medical advocates are put into the hospitals.
Okay.
I am put into Reading Tower Health.
Okay.
And my role there, I really have two main goals there. And the one is education. And my role there is to educate doctors and providers on what domestic violence and sexual assault and human trafficking is, as well as how to screen for it and how to follow up when somebody does report a positive screen.
Okay.
So that is part of the role there. The other part, which is kind of the more popular part of the role, is to respond directly in the hospital to any positive screens of domestic violence, sexual assault, or human trafficking. And that is, we've been doing that for years.
Right.
We've always, if you called the hotline, we were going to be there. We would come out, meet with the victim. The only difference now is I'm on site.
Right.
So I can respond within 5 minutes.
That's great.
So.
Yeah, that's great. Well, so you're there to directly help the survivors in the hospital setting.
Yeah.
Yeah, that's great. And listen to them and offer the Safe Berks services to them too.
Yep. I'll go in, typically it's in the ED, I'll meet with them right after an abusive situation. But I have been called to outpatient services where they're not in the crisis right in that second, but they were reporting domestic violence, just needed some help.
Right.
And I'll go out, I'll kind of assess where that victim is, I'll meet them where they're at. If they're ready to leave, I'll help them get in touch with our services, maybe our shelters, services in the community that'll help them leave the abusive situation.
Right.
If they're not ready to leave, I will sit there and I will take my time to safety plan with them to help them the best I can through that tough situation.
Excellent. Well, that is a terrible situation for anyone to be in, but I'm glad that you're there to help them and that the other MAPP advocates. And we have a full-time person, Letty Vasquez Pena, who is located at Penn State Health St. Joseph. Yep. And then we have Myra Morales, who is working full-time for Safe Berks, but within the Berks Community Health Center.
Yep.
So there's three of you, and you're a team.
Yes. You
all have similar jobs, but in different locations.
Yeah.
Yeah, and then you get together and kind of bounce ideas off each other.
Yeah, we do. We see Myra is in a community center.
Right.
So what she sees is very different than what I would see in the emergency department.
Right.
But it's still really nice to get together and discuss the different ways to go about.
Right.
Because there is no one answer to how to respond to domestic violence and sexual assault situations. Right. So when we do come up with innovative ideas, it is nice to share. And we're getting it across a lot of Berks County when we are sharing it amongst the three of us.
Excellent. And what I was learning too is that this new program, which as you were saying is kind of an outgrowth of the work that we've been doing for years with the hospitals, but it's become bigger now.
Yeah.
There's this healthcare advisory committee that sort of oversees this, and it's people from Safe Berks, people from all the different hospitals and healthcare centers coming together to meet and discuss how to best serve survivors.
Yep.
Yeah, that's awesome.
So the Healthcare Advisory Committee was started by one of our board members, Timothy Marks, who also works for Tower Health. And our main goal that we're working on, we have all the health centers of Berks County. We try to have each one represented at this meeting. And right now what we're doing is trying to come up with a best practice screening tool. So that way we aren't missing victims that come into the hospital
Yeah.
or into their doctor's office or into a community center.
Yeah.
Making sure that wherever you're going, you're getting the best practice and the best screening tool.
It's a great idea, and I've heard some of the conversations going on around this where what if every single health provider always said something like, is anyone hurting you? You know, to every single patient, even dentists, even, you know, primary care doctors, because that way a lot of people that might feel very nervous or scared to share this, if someone's directly asking them in a private situation, they might feel really much more confident to share that. Yeah, so it's really good work.
Yeah. A lot of what I say when I meet with providers is they might not be ready to leave, but we need to plant the seed that when they are ready, this healthcare facility is ready to help them with their needs, and we're willing to listen, and we're here. So it's really hard for nurses and doctors to be like, but I can't help them right now.
Right.
So I just explained to them it's really important just to plant that seed that we're a safe place for them.
Yeah.
So I think just that screening and just that question is showing that healthcare provider cares.
Right.
So and I think that's very important.
Yeah, so it's in the back of their mind, and if they choose to wait a week, if they choose to wait a year, they know Safe Berks is there. They know the hospitals and the medical centers are willing to help and connect. Yeah, that makes a big difference.
Yeah.
And tell me about the training part of your job, and you and the other MAPP advocates. Do you kind of create the trainings based on what is needed, or what is going on with that?
So we work very closely with the education department as well.
Okay, oh great.
And we'll take a lot of like their domestic violence 101 presentations,
Right.
and we will kind of specify them towards the healthcare setting.
Excellent.
So when I'm meeting with them, I'm kind of just discussing it it's really important to get it from that medical standpoint.
Right.
So just editing the PowerPoints and the presentations on more specific to the healthcare settings.
Great. So you're doing trainings to doctors, nurses, people who work at Tower Health Reading Hospital, so that when they are working with the patients, this is in their mind that they might be a survivor of domestic violence. They might be a survivor of sexual assault.
Yeah.
Yeah. That's great. How do you find the response in the trainings? Are you finding, a good response?
Oh, yeah.
Really?
Yes.
That's great.
I have not had one person say that it was a waste of time.
Right.
I've always when I'm talking to them, very engaged eyes.
Yes. Yeah.
Tons of questions.
Yeah.
Tons of thank you so much. We're so glad
That's
you're
great.
here.
Yeah.
Tower Health Reading Hospital is so amazing and has welcomed myself and Safe Berks with open arms.
And I can tell because how busy you are.
Yes.
You're always going
Yes.
to another meeting, another training, which is
Yeah.
great.
Yep.
Because it means you're really engaged.
Yeah.
And in between helping the victims and doing the trainings.
Oh, yeah.
Yeah.
We have seen, since we've been on site, we have seen quite a number increase. In January, we had 5 medical advocacy calls. To date, we've had 33 for this month. So.
Oh my gosh.
Yeah.
It makes me feel sad because those people are out there being hurt, but it makes me also feel hopeful because they're getting more help.
Yeah.
Because those numbers were probably always there. It's just, are we able to reach them?
Yeah.
Yeah.
Yep. And we are, and that's the important part of being in the hospital.
Yeah.
Is we're reaching them. We're not missing anybody.
Right. You're right there. And I know our time is getting short, but I did want to ask you one other question. And that is, for people, whether they work in a hospital or some other medical setting, dealing with people, whether it's domestic violence, sexual assault, or any other trauma, any words on what that trauma experience is like for people and how people can best help people that are dealing with trauma?
I think a lot of times we don't know how to respond to trauma. It doesn't portray itself in the way we expect it to, especially for first responders responding directly to somebody after they've been assaulted. A lot of times we might expect them to be sitting there crying and that typical response, but that's not always it. They may have a very flat affect.
Yeah.
They may be completely disengaged, not want the help right now.
Right.
Their memory may be not there because they've been through so much.
Yeah.
So it's very important that we just be patient with them, and
Right.
we just be there with them and we believe them.
Yeah, because each person, I think you've told me this in your work, each person responds to trauma totally differently.
Yeah.
So there's no one response, and
No.
there's no wrong response. It's
No.
however that person is able to deal with that.
Yeah,
Yeah.
and we know a lot of times our bodies will go in the overdrive, so sometimes we may be laughing right after it.
Right.
Whatever feels good to that person to
Right.
deal with that
Right.
overwhelming trauma.
Right, and that the people can reach out, whether someone watching this needs help themselves, or whether you're a medical professional, you want to reach out, or it's someone that wants to help Safe Berks. Yeah, thank you so much for everything you do. And you can learn more about our services on our website at www.safeberks.org. Thank you.